Our next guests are uniquely qualified to help us understand the fine print. Republican Senator John Barrasso of Wyoming, Republican Congressman Tom Price of Georgia, and Democratic Congresswoman Eddie Bernice Johnson of Texas. Senator Barrasso and Congressman Price are also medical doctors, while Congresswoman Bernice Johnson is a registered nurse. Thank you all for being with us today. If the president is signaling a public option is not essential, then would House Republicans maybe say it's time, maybe you'll go down to the White House and say, Mr. President, here's what we can do?
Well, we'd love to go down to the White House and work with the president. And the fact of the matter is that this notion that there's just two options, the government option or a private insurance option, is just simply false. There's a third way, which is the right way, we believe, which is a patient way, a patient-centered way to put patients in charge. And there is a way to get folks insured without having the government option. If you have the government option, then what that does is crowd out all sorts of folks from private personal insurance to the government-run program. There are all sorts of studies that demonstrate that. The Congressional Budget Office demonstrates that. The Heritage Foundation. Tens of millions of individuals would be moved from their personal private insurance to the government-run program. We simply don't think that's acceptable.
And Congressman Price, I want you to take this one. I'm going to zoom into the state of Maryland. Senator Ben Cardin had a town hall up here in the Hagerstown area, and you notice he's a Democrat, but this is the conservative part of the state up here. Here was the question put to Senator Cardin.
Say my dad and my grandfather both came down with cancer. Would my dad get priority care because he's younger and can contribute longer to society?
Interesting question from the young man there. Would the government, Congressman Price, be involved in those decisions?
It's very concerning, John. I'm up here in northern Michigan visiting my mom who had a recent bout of cancer. And I believe that the surgery that she was allowed to have and the chemotherapy that she was allowed to have in the House bill would not be available to her. And that's why you see seniors across this land so very concerned, because the proposal in the House is to decrease, is to cut $500 billion from Medicare. They know that that means a decrease in the quality of care and the level of care that they're able to receive, and it's not acceptable to them, and it's not acceptable to us, especially when there are positive ways to solve this problem without throwing everything out and making it so that the government's running the show.
Congressman Price, I want to go to you first. Many conservatives have said, you know what, to say there are death panels that the government can pull the plug on grandma is simply wrong. Does it hurt your cause when conservative critics are misleading people and are twisting the facts?
Well, I think this is symptomatic of the process that we've been through, and that is that it's been mostly in secret, that it hasn't been a bipartisan way, certainly in the House. The concern that people have across this land is what role is the government going to play? Who's going to make these crucial decisions? And when they go to that area of the bill and they see that the government will mandate, will dictate that the physician and the patient who is eligible for Social Security have that conversation at least once every 5 years. And then they see earlier this year that the Comparative Effectiveness Research Council was put in place, and the Congress refused to say that it would only deal with clinical situations, it would also deal with cost. And you put those things together, and people have a reasonable concern that the government is going to be making decisions that ought to be left to families and patients and doctors. That's where these decisions ought to stay. The problem is that's not what the bill says.
Is that right, Congressman Price?
Not at all. In fact, the status quo is unacceptable. Everybody appreciates that. We believe strongly that there ought to be appropriate reforms. We need to keep what's good in the current system and fix what's flawed. And the way to do that is to make certain that everybody is able to have health insurance, that insurance is portable. They can take it with them if they change their job or they lose their job, and that medical decisions stay with doctors and patients. There's a way to do that in a responsible way. Doesn't require increasing taxes one bit at all.